Acromioclavicular joint osteolysis. Acromioclavicular joint osteolysis or distal clavicle osteolysis, also called weightlifter's shoulder, is a painful damage of the distal end of the clavicle, collarbone. It is an overuse injury that causes tiny fractures along the distal end of the clavicle. Because the bone doesn't have a chance to heal before the next injury, the bone actually starts to dissolve. Causes. Acromioclavicular joint osteolysis can be seen in strength and power athletes, such as weightlifters. It is also more common in heavy jobs, such as plastering and operating an air hammer. Symptoms. You feel an aching pain in the front of the shoulder at the acromioclavicular joint. There is often shoulder weakness. Pressing on the AC joint causes increased pain. Lying on the affected side can disrupt sleep. Diagnosis. To diagnose acromioclavicular osteolysis, you should answer to your doctor questions about your symptoms and medical history. Your shoulder will be examined for signs of previous injury, tenderness and pain points. Your doctor will order shoulder X-ray. Radiographs can be normal or can show signs of decreased mineralization and a decrease in distal clavicular width as compared to the opposite acromioclavicular joint. Treatment. Distal clavicle osteolysis is initially treated conservatively with rest, restriction of movement, and if there is severe pain, the shoulder may need to be held in a fixed position with a sling. Ice application over the acromioclavicular joint after activity can decrease symptom severity. Any activity associated with the injury should be stopped. A doctor will recommend a nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce inflammation and relieve pain. A steroid injection into the AC joint may also provide temporary or long-term relief. When the shoulder is reasonably healed and the inflammation has ceased, physical therapy would be started to restore range of motion and strength. Patients who do not respond to non-operative treatment or who cannot limit their activities may benefit from surgery. The surgery consists of a distal clavicle resection. Removal of between 5 to 10 millimeters of distal clavicle is recommended to eliminate symptoms. Rehabilitation. We recommend that you use a sling for the first 2 to 3 weeks after surgery. Physiotherapy should be started 2 to 3 days after surgery and usually continues for 3 months. It takes at least 2 to 3 weeks after this surgery before patients can drive well. If you are working at desktop level, then we recommend that you return to work around 1 to 2 weeks after surgery. Heavy laborers and athletes may take longer than 3 months to have normal function and ability to lift overhead. You will be able to return to full activity at 2 to 3 months after surgery.